some little exercises and stretches that we can do when there's some body tension present, and feeding difficulties and prepping for frenectomy. This is a sweet little 3-week old here for a consult for lip and tongue tie. And as you can see, her lower jaw is set back really far compared to her upper jaw. So first I want to show a lateralization exercise that we can do, where if you put your finger in the mouth of the infant, hey sweet girl, you should be able to move your finger side to side along the gum line, and her tongue should follow. And that's a reflex that all babies should have, so that can help with tongue strengthening. Also, suck training, where I put my finger in her mouth and the pad of my finger goes in the roof of her mouth, and she should be able to get on my finger and stay on my finger without popping off and without gagging. So right now she has a shallow latch, so I'm just tugging back and forth. We call this tug of war. And I'm trying to get her to take my finger more to the soft palate. Now you see when I edge my way back to the soft palate, her upper lip curls under a little bit and she pops off and gags, okay? So this is something that we're gonna practice at home to see if we can desensitize the gag reflex and get a deeper latch. Good job, baby girl. So my finger should be positioned in the mouth if she has a deep enough latch where it goes all the way to her soft palate. And you can feel, as the clinician or the parent doing this, you can feel the pad of your finger go from the middle of the hard palate to the squishy soft palate, and it's a distinct feel. And normally on my finger, the second knuckle of my finger is at the level of the baby's lips, right there. Good job, baby girl. And when we're doing this, if the lip curls under, then you can help to flange it back out. But she's doing pretty good here, okay? Also, when we're doing this suck training, and whether she's on the breast or the bottom, if you see popping off a lot or weakness, and or if they're dribbling milk out of the corners of their mouths, that will really cause a lot of gas issues because they're swallowing air. You can do cheek support and or chin support. Just reposition my legs. Thanks, Mom. Okay. Hi. So with chin, so see those bubbles coming out of the corner of her mouth? She lost a good latch there. So chin support is where you just take your finger, other finger, and put it underneath the chin so she doesn't have to work as hard. Hi, darling. But she's still blowing bubbles. So you can also do cheek support, where you squeeze the little cheeks like that, and then she can't blow as many bubbles. Or you can do cheek and chin support. So here I'm in a little bit of an awkward position, but I'm squeezing her cheeks and I'm using the bottom part of my finger to help support the lower jaw. And if they're on a bottle, say you have a bottle in your hand like this, you're holding the bottle, you can squeeze the cheeks with your thumb and middle finger, and you can use your ring finger to go under the chin, and the bottle just rests here. Good job. You're being such a good sport. Okay, let's see. What else can we show our friends? So windshield wipers. I like windshield wipers a lot. I usually do this from behind the baby's head, but you can do it really however you want. You take your fingers into the cheeks and you just massage like that, or if I'm behind her, I'm doing this. And just loosening that up, and sometimes we swipe inside the lips too to loosen that up. She wants to suck, she must be getting hungry. Good job. And another exercise that we usually have to do when prepping for a frenectomy, and for instance with this baby, I'm not even 100% convinced that she's tongue-tied. She's got a lot of floor mouth tension, and I suspect that her lingual frenum is embedded in the fascia. So you go under the tongue and you do a corkscrew exercise is what I call it. I like to use my right hand to go opposite to her right side and left hand to go opposite to her left side. So you go under the tongue, and I'm trying to get between her lingual frenum and the inside of her jaw. and I'm massaging the floor of mouth. So it's really tight in there and it's hard to get under her tongue. So I'm gonna use my pinky, since my pinky is smaller and I have pretty small hands. So, and I'm gonna try to get underneath there and just gently work my way into the floor of her mouth. And it's like, we call it corkscrews because it's like opening a bottle. And no, baby, I'm so sorry. And you're not poking into the back of her throat at all. You're massaging down into the floor of the mouth. And the other thing you can do a lot of times is massage this muscle under the chin, like behind the chin, because they're tight there as well. And that helps to just soften the floor of mouth and loosen tissues up to prep for the frenectomy, and or to tell us if we even need a frenectomy. If all the tissue is real tight in there and there's a lot of dense fascia, it can be really hard just to even get the release done. Hard on baby, hard on parents, hard on the provider. So if we can loosen up as much tension as possible, we have a better release outcome and a better opportunity to help the child in an easier time during the procedure. So let's see. Now I'll let her calm down a little bit, and then I'm going to show you the guppy stretch. Let's see. Hi, you're awake now. Let's see if we can show guppy. With guppy, it's really good for these babies that are real tense and tight. Hello, where's mommy? Do you see mommy? So I'm just laying her here, and I'm not letting her bring her head back too far at first because it's going to be uncomfortable for her. But I'm trying to get her to do a little head hang and loosen up some of those neck muscles. And I'm trying to get her to practice turning her head both ways. So you can put a sibling or a TV or a parent on the opposite side to encourage her to turn her head both ways. A lot of times this is easier to do when they're sleeping. See, I have her pretty mad right now. Let's calm down a little bit. It's helpful to do this when they're sleeping because it can be a little uncomfortable and they don't love it. Let's see. Hi, can you do it? Let's see if we can stop again. So we're going to show you the guppy stretch, and this is going to also incorporate the sleeping tongue resting posture hold. So sometimes some babies don't mind this and you can do it with them awake and be playful with them, but a lot of times the guppy is easier to do when they're sleeping. And of course the sleeping tongue resting posture hold, they have to be sleeping. So I'm just letting her stretch her little neck, and I'll take her little chin and gently drive her lower jaw up and forward. So again, if she's sleeping, she has an easier time with that. But we want the tongue to be in the palate, not in the floor of mouth. So with doing this exercise, I'm practicing her driving that lower jaw forward and getting her tongue in the palate. When you're doing the guppy stretch, you can do it with a tug of war like this. You can do it with a pacifier, because that also helps to drive the lower jaw forward. You can do your cheek and chin support too. Okay, and then lastly, I don't know if I'm gonna be able to show sleeping tongue resting posture hold because I have her awake. But let's see, can you sit up? Good job, girly. And then over time with the guppy, the more and more she loosens, you can let that head hang further and further down. So she's getting more loosening of those muscles. And then trying to help relax the shoulders to work out some tension. See, that's not so bad, huh? And then when you're holding the baby, we always want to breathe through our noses. So whatever we can do to help promote nasal breathing is really good. A lot of these babies have high vaulted palates because their tongues don't live in the roof of their mouths. I encourage my patients to, when holding the baby, if the mouth is open, especially when they're sleeping, just to kind of help drive that lower jaw forward and close their mouths. So they're never just sleeping with their mouth wide open. I'm wearing you out. You need to go back to sleep, huh? So if you look at her tongue, it elevates when she cries, which is better than some of my patients do. But I want to help close her lower jaw, hold it for a few seconds, and then help her open. And then she'll do a tongue pop. But I woke her up too much during the stretches to really show this exercise. On a patient that can understand what you're trying to get them to do, you can practice clicking your tongue or doing tongue pops. But that's different for a baby because they don't know how to do that. But you can help to drive the lower jaw forward in the position where lips are closed and sealed, and you hold the mouth closed for a few seconds. And then so you're doing this, hold, hold, hold. Then you put your finger on the chin and you help to pop the mouth back open. And their tongue should go, it should cluck. So you're just encouraging that tongue to go up in the roof of the mouth. So you can look up Michelle Emanuel. She's an occupational therapist. She gets credit for this exercise, and she has great YouTube videos that show how to do the sleeping tongue resting posture. And the last exercise I'll show is palatal stretches. I'm gonna give you back to Mama for a second. They don't love this one, but let's roll this way, Mom, a little bit. And like I mentioned before, you have high vaulted palates with a lot of these babies. So when we're so young, our sutures, just like you have a soft spot in your head, you have a palatal suture that goes down the middle of your palate, and just with firm finger pressure, you can get some natural palatal expansion at a young age like this and maybe prevent orthodontics in the future. But you put your fingers in the middle of the hard palate, as high in the palate as you can, and you slowly but deliberately push out. And you just do that a few times. And with this, since I'm pushing on bone, I'm gonna push a lot more firmly than if I'm just doing a windshield wiper like this. If you're on soft tissue, you're not pushing hard. But if you're on the palate, I'm using pretty firm pressure here. So you just do a couple of swipes of that. And those are the kind of things that can, oh, hi! See how I'm rubbing underneath her chin here? Those can help to loosen her up before. And then let's see these hands, Mom. Another thing you can do to loosen up some body tension is get their little hands and, hi, we're gonna play this game. And just let her try to hang. Oh, look, you see how her little head just gently dropped there? Trying to stretch her. I know, you a tight little thing. Stretch. And of course, I'm putting her through a lot all at one time. But we work our way up to doing all of these exercises and getting her more comfortable.